Okay.
Jesse, I started recording.
Oh, thanks so much, Natalie. So we're good to go there, and I think we can go ahead and get started. It's my pleasure to facilitate a conversation with Natalie El-Deiry, IRC in Salt Lake City's Executive Director, Josh Lloyd, our Deputy Director of Programs, and Pamela Silberman, our Health Program Manager. We put together a list of questions we received over the past weeks and wanted to take time to discuss them today. So I think I'd like to begin by starting to have each panelist introduce themselves and provide a brief overview of their role in the IRC in Salt Lake City's COVID-19 response. And Natalie, let's go ahead and start with you.
Sure, great. Thank you, Jesse. Hello, everyone, and thank you for joining us today for our virtual town hall. As Jesse mentioned, I'm the Executive Director at the IRC in Salt Lake City. I also oversee our Missoula office as well. I've been with the Salt Lake City office for 10 years, and I just marked my first year as the office's Executive Director this month. My role at the office is to lead our operations in Utah and being as responsive, effective, and efficient as possible to provide services to close to 2,000 refugees and other immigrants we serve through the incredible work of around 60 staff members and 1,500 volunteers. My role has become even more critical in this time of crisis, as we've seen with COVID-19 pandemic, and ensuring that we can continue to respond while keeping our staff's safety and well-being at the core of our response and continuing our services to the best of our ability. Following the directives from Governor Herbert and Salt Lake County and city mayors, I made the decision to close our office to the public on March 18th. And we will remain closed until early May as we plan for a phased reopening that is appropriate and safe for our staff members and our clients. And so a lot of my role right now has been monitoring the state and local response and ensuring that we can continue our business operations during this difficult time.
Great, thanks, Natalie. Maybe Josh, we can move to you next.
Oh, Josh, you're muted.
Go ahead and you should be.
Thanks, Jesse. Thank you. Yeah, I'm Josh Lloyd. I'm the Deputy Director of Programs at the IRC Salt Lake City office. I have worked in that office for 13 years, principally in economic empowerment. My role during this sort of crisis time around the COVID pandemic has been in working with our resettlement, education, and economic empowerment programs to sort of meet kind of some of the urgent direct needs that clients have in connection with the pandemic. For sure, kind of basic necessities as well as their financial needs, challenges coming up, educational, and critically this time sort of digital inclusion piece that is that's become so critical in the present environment. So I look forward to the call today and informing you on what we've been doing.
Great, thanks, Josh. Go ahead, Pam.
Hi, my name is Pamela Silberman, and I'm the Health Program Manager at IRC in Salt Lake, and I've been with the organization for about 4 years. Thank you so much for everyone to join us today and for us to share out what we've been working on the past month or two. As the Health Program Manager, my responsibility is always to make sure that our clients have access to basic health care as well as mental health resources, women's protection and empowerment programming, as well as health promotion education so that clients learn to navigate the U.S. healthcare system effectively once they're no longer supported by the services of IRC. That hasn't really changed in this environment, although we certainly are seeing some shifts in terms of essential health services and those that might be considered non-essential, as all of us are experiencing. In addition, I've worked along with Natalie as our COVID focal point for the office to make sure that we're gathering information, helping get it translated, and passing it out to both clients and staff to make sure that they're getting accurate and usable information as this pandemic evolves and the guidance from our public health authorities evolves as well. and work closely with some of our key partners, including the Utah Department of Health. I see that our state's refugee health manager is on the call with us, and we rely on those essential partnerships to make sure that our clients have good information.
Perfect. Well, thank you, each of you, for taking time to discuss today. I think for our first question, I would like each of you to take a moment to answer. We all know how much the COVID-19 pandemic has impacted our personal lives. So what's changed at the IRC in Salt Lake City, and how have programs adapted to the pandemic? Natalie, if you want to go ahead and kick us off, that would be great.
Sure. Well, due to the nature of IRC's work in the humanitarian sector and offering services around the world, as an organization, we've been monitoring the spread of the pandemic closely since about February. And we saw as the intensity of the virus grew, particularly in Europe, we knew that it would only be a matter of time before all of our offices in the United States would be impacted and need to be implementing plans to keep our staff and clients safe. Nonetheless, it was quite challenging for us to figure out how to pivot our work and what work remote settings look like for a staff in an office who are hustling and bustling daily. For many of you who have visited our office on a regular basis, you're used to seeing the client flow, the people coming in and out, our staff members in the field and in the office doing the critical work that we do. So quickly, we developed risk mitigation plans and business continuity plans, both for our office, and then each program was responsible for developing their own business continuity plan so that we could ensure that essential services would continue while we asked staff to work remotely. We prepared staff as best as possible to work remote by ensuring that they had the proper technology to do so. And I'm actually really proud to share that this was an investment that we've been making as an organization prior to COVID-19, ensuring that we had, a lot of our work is cloud-based, that all of our staff have laptops and proper equipment to be able to work in office and in the field, which resulted in the infrastructure to support this type of work remote transition quite fluidly. Of course, there's learning curves for all of us in this process, but it was it was helpful that we had been starting to do that work in the past. I've been incredibly impressed with our staff members' ability to pivot and adapt services to continue to serve clients. We contacted almost every client we've served over the past 2 years in a matter of 10 days, which is over 500 households, to conduct well-being checks and provide accurate information on COVID-19, and to assess their needs in terms of livelihood, who's being impacted by loss of income, what barriers to education are clients experiencing, what immediate needs do they have with food and hygiene kits, and so on. Through that, we delivered over 300 food and personal and household hygiene kits to clients, and we continue to do so. We ensured that clients in our case management program had access to computers that are available through the schools, and for those that did not, we delivered donated computers to them and assisted people in getting internet set up in their homes if they didn't have that already, and that was to 150 households. And this is all a matter of about 3 weeks, and or a little over a month now since we had closed the office. Also today, we've provided close to $10,000 in emergency assistance to clients, mainly to assist with April rent. This is about a 75% increase in the usual emergency housing assistance that we provide. And we're anticipating, another surge of that emergency assistance being needed as May rent approaches. So yeah, programs are making adaptations to continue to serve clients in a variety of ways through our casework, economic well-being, our education, our health teams, and so much more. Josh and Pam can share a little bit more on the program side of things.
Yeah, Josh, maybe we can go move to you next.
Yeah, sure, great. So a couple of the adaptations that we've been working on for sure. One is working to connect clients to COVID-related assistance that they might be eligible for, with the added challenge of assisting them remotely with that. So our economic well-being team has been focusing on support to access those things, unemployment insurance assistance in cases where clients are eligible for that, the stimulus payments through the CARES Act, and then the small business support as well. And so we've been working to provide unemployment insurance support by identifying clients who are in need and who are eligible to help them fill out the application remotely or answer questions connected to that process as it's complex. And then now, in more recent times, identifying clients, this expanded group of folks who would be eligible for the COVID-specific unemployment insurance, which we can talk more about. For sure, we also want to ensure that clients who are eligible but have not yet filed taxes either file taxes or get connected, entered into the IRS database so they can receive the stimulus package, direct payments that are part of the effort to blunt the economic impact of COVID-19. And then the third area is sort of working with our small businesses that we serve and broader small businesses in the community when needed to apply for financial relief that works for them. Connected with that in particular is the IRC has developed a new product that's specifically designed for this time called resilience loans. These apply wider than small business, but are maybe applicable to a lot of our small business clients because many of them maybe don't have personnel, so they don't qualify for PPP loans or they don't need a large amount. And so the way the resilience loans work, which are now active and available, and we're making them, is that those are 0%, no fee loans that we can provide to households. Folks are eligible for $500 per adult individual in a household, up to $1,500, and then no payments for the first 6 months of after receiving the loans, and small payments for the next 10 months after that. So that's a way to get some immediate cash into people's hands beyond the other resources that I already mentioned, and also a way to help them navigate and learn the loan process if they haven't done that. So those are kind of immediate areas where we've been working to help and support people so they can access those resources. I guess I'd say the other broad area, which has been mentioned a little bit, is just working our programs to continue to do services in existing programming remotely as possible, trainings and one-on-one services. We'll talk more about that as well, but we've been exploring and using and piloting across the gamut of kind of platforms that would work for different clients based on their connection and hardware and literacy situations to find ways, opportunities to serve them and progress them in the programs that they were already participating.
Thank you, Josh. And Pam, if you want to speak to the question.
Yeah, so for the health team, we have continued to transport clients to medical appointments and facilitate access to those and provide interpretation, although those have been pared back to the essential medical appointments, which include the health screenings that newly arrived refugees receive, emergency dental care, making sure that clients have sufficient food through the WIC program, also the latent tuberculosis program, doing intakes and medication distribution. We've also continued with prenatal appointments. In fact, 2 babies have been born to IRC clients during this COVID stay-at-home period, and making sure that the moms and the babies are comfortable, in the hospital and receiving the care that they need, and then doing follow-up newborn appointments. We really have taken the safety of our staff and the clients really seriously, and so all staff that have been continuing to be out in the community have received transportation kits, which included masks, hand sanitizer, sanitizing wipes, and gloves. And then we developed a protocol where they would ask about illness and symptoms prior to visiting the family's home to pick them up, and then also providing masks to clients to wear out in the community. And we've received hundreds of homemade donated masks, some by refugee seamstress, that we've been able to distribute to our clients. So that's really wonderful. as we know, the hospital and clinic visitor policies have been shifting, and so we're really trying to stay abreast of those and then limit how many staff and clients attend an appointment, not necessarily the entire family if only one family member has an appointment, and yet still ensuring that our clients have our support to navigate. We don't want to just leave them at the door because they may not always be to themselves to ensure that they have interpretation or understand the instructions they're being given. We've also seen a shift to telehealth appointments and have successfully completed a few of those with our clients, but they take a lot of preparation. Certainly the fact that, as Natalie and Josh mentioned, we distributed technology, computers, and internet access to our clients, that's been incredibly helpful. But it still takes a lot of preparation, particularly because many of the clinics, each clinic uses a different platform. And so if the clients learn how to use one, another provider might be using a different platform, although we had a call today with providers talking about, trying to be client-centered around that and see what the clients are able to use, and maybe the providers can shift to what the clients have access to. We've also been able to deliver psychosocial support groups via technology, and so that our clients who are struggling, who were already perhaps struggling with their mental and emotional well-being, and then obviously this exacerbates that for all of us, have access to that kind of support.
Great, thank you, and really just kind of shows how much it has really changed, and how many of the quick pivots that have needed to be made by the IRC, but also by so many others in the community, and the challenges that have really been presented throughout this time, and I think that's kind of where I'd like to shift the conversation next. Is while COVID-19 affects everyone in our community, we know that people who were more vulnerable before the pandemic spread are disproportionately impacted by its effects. This includes many of the people served by the IRC, such as those from the refugee and immigrant communities, including some families who have just recently arrived. I guess for the panelists, what are some of the biggest challenges faced by the people we serve that you're seeing? And maybe Pam, if you want to continue there, do you want to provide the first response?
So I think this delay in access the non-essential care, and again, I don't think it's unique to refugees, but sometimes these challenges are compounded for refugees. And so if healthcare is delayed for our clients, it could mean that their health conditions worsen or become more debilitating over time. We're particularly concerned around our elderly clients, or those who are particularly vulnerable due to different types of physical or mental disabilities, who may not be able to access, for example, telehealth. An example is that most of our clients have never had access to dental care. And currently, dental care services have been delayed indefinitely, except for emergency dental care. If for most of us who've received regular dental care, if we go, 6 months or even a year without seeing the dentist, it's not ideal, but it won't really jeopardize our health. And so our clients who have untreated cavities, gum disease, that can really develop into much more serious conditions that affect their entire body's health. And so that's just one example of kind of, we see dental care as non-essential, and yet for people whose health is already fairly fragile, it can really become a much worse situation. The other challenge, there's concerns about client safety given the stress and the isolation and of this time. And so we certainly have seen, and we know this is happening worldwide, some increase in domestic and family violence situations. Perhaps they were occurring or at the surface, prior to this, but now have escalated during this time. And it becomes very difficult to assess the level of danger that someone is in or remove them when both the victim and the perpetrator are kind of stuck at home together and continuously. Normally, we would have a survivor come to the office so we could screen them and do safety planning. But that's extremely difficult to do because for a victim to leave a home in a controlling situation during a stay-at-home time, they have to come up with an excuse. Why are they leaving? How long will they be gone? And obviously with our office closed, lots of times we have clients just come into the office and disclose. And so also by being at home and not having the privacy that they might need, these disclosures become even riskier because they could escalate the violence further. So we've really gone back and forth how to best support clients who may be experiencing domestic violence or family violence during this time. So those are some of the challenges we're facing.
It really reminds me of a quote I've seen recently that we might all be weathering the same storm, but we're not in the same boat. And that some families might be experiencing more challenges than others, and that's kind of a challenge to reach out to them. Maybe Josh, if we could move on to you next, what are some of the biggest challenges you're seeing, or your staff are seeing, of the people that we're serving?
Yeah, so there was one example that had occurred to me that sort of in terms of how this challenge is kind of layered on top of kind of the tenuous situation that our clients are in. And it's the example of a recently granted asylee from Venezuela that we're just starting to work with. So she had come here to the United States, applied for asylum, had been going through that process, which the waiting process to be actually granted the asylum status is often lengthy, and figure out how to live during that time with minimal support. You're not eligible for public support. You can work in some cases, but it's really on the edge. And we've been working with this Venezuelan woman who was formerly a physician in her country, who came here, was happily granted asylum, but then also contracted the COVID-19 disease and had already been tested positive and was dealing with that at the time that she had heard about our services and had reached out to see how we could help her. Naturally, we're very excited to help her and support her, both in particularly challenging time right now and then ongoing as she gets into employment and figures out how to continue her career in this country. But in the meantime, what extra burden for her and then us to figure out how to serve her in this time when we're remote anyways. And she actually is a person who has the disease right now, is doing fine so far in terms of her symptoms, but looking for ways to serve her remotely and offer the support that we need. Luckily, she comes from a background where a little more she's able to engage in the digital, but still a difficult time for her as we figure out how to navigate best supporting her. And I think that's true for a lot of our more recent arrivals. We just prior to sort of this happening, we had a pretty busy arrival time, as some of you are probably aware of, compared to the recent past. And those folks arrived here and then sort of entered into this situation where they've been more isolated and had to act more independently than they would under normal circumstances. So that's one piece. I guess a couple other things I would mention is sort of challenges around helping people access some of the benefits I was talking about before. So for sure, the unemployment insurance application process and then post-application process is complex and particularly onerous right now, as we've been seeing in the media for everybody. That for sure applies to refugees and others who have language or literacy or digital inclusion challenges that make that more difficult. So we have been supporting clients in that realm for sure in making those applications, but just little things that come up that really put up barriers, and we have to figure them out. A lot of our clients, have received assistance, public assistance before, and so when you're doing your unemployment insurance application, you have to create a PIN number in addition to your password and your login in order to do that. And for folks who have already received assistance in the past, they have an existing PIN number in lots of cases. That was probably made when our clients first arrived for most of the people we work with, and they don't remember what it was, and in order to change that, they have to talk to a real person. As we've also been seeing through the is a real challenge. So kind of those pieces, the stringent documentation requirements around unemployment insurance is another element that is harder for us to support clients in a remote environment, and with employers often closed and maybe accessing records or documents from them more challenging. And then I guess the last sort of big area, and I know it was included in some of the questions people had passed along, was around sort of the online learning challenges for students who are no longer in school, our refugee students who, face other additional barriers in some cases. And the effort of IRC staff has really been heroic to ensure that households have connections and computers, but sort of the technical literacy to log in every day, select apps, interact remotely with teachers. Each of those has their own challenges, and even if we take precautions and work through that with a student or a household once, there's no guarantee that they're going to absorb all of that information and be able to interact again the next day to continue sort of their online learning school. So it really is a challenge that we're continuing to address, and we can speak more about it, but that that has been a hard part for any families with school-age children, but particularly for our refugee families, they face more barriers that have been challenging to address, I think.
Okay, and Josh, do you, not to put you on the spot, but do any families come to mind that we've been able to provide some of those supports to, or that you've heard about specifically?
So a lot. Natalie had mentioned kind of the 150 folks that we had helped to connect. And what that number represents really is ensuring the hardware is there, navigating the connection. Some people maybe had an existing connection, many didn't, even in spite of our efforts even prior to this to do this. It's an ongoing challenge to get that. And then an individual one-on-one setup in going through how to access their online pieces. So for sure, that is a huge victory to get to families to that point. And a lot of our sort of tools to then interface with them can happen. That's the first step. Not unlike kind of what Pam was mentioning with the clinics, different school districts or different schools have different platforms, or teachers use different apps. So then it does multiply out from there. Some of the sort of efforts around addressing that for sure have been working with some of the school districts have held sort of online parent trainings with interpreters to help them understand some of the dynamics so that they can help their students to better engage. So that's helpful. Teachers individually are certainly interested in helping and troubleshoot individually there in many cases, but it is more challenging to do remote there. So yeah, it is an ongoing struggle, but for sure we are taking steps that are positive in helping people connect in that way, I think.
Great. No, thank you so much, Josh. And Natalie, I know Josh and Pam have covered quite a lot of ground with some of the challenges faced, but I'm sure you have an example or some of the challenges that have also bubbled up to you as well.
Yeah, just a few things, just that I wanted to highlight in addition to what Pam and Josh had shared, is that often, we're a safe place for clients to ask questions, a trusted source, or for families to share fears and concerns and the hardships they're experiencing. Oftentimes they are clients, sometimes they're just other community members from the refugee and immigrant community. We've had some asylees reach out to us. They're not grantees yet, they're waiting their asylum status. And frankly, there's not a lot of resources for asylum seekers in Utah. And so trying to navigate what we can do, we can provide in-kind donations, but can't do case management. There's, some different areas that definitely there's some gaps that we've seen. And we might not always be able to address everything, but we do our best to respond and to provide, some resource for other immigrant community members and the asylee, the folks who are waiting their asylum status, or the one particular group that comes to mind. One other moment that was quite salient for me over the past few weeks is a family of 8 arrived shortly after our office closure. Just as our office was closing, it was a pretty intense moment for us. People learned, figuring out how to work remote, what physical distancing looks like, understanding whether we have appropriate protective wear for staff to be in the field, and so on. And then you can add an earthquake on top of that as well, and it all kind of compounded. But I saw our staff come together to make sure we could get a home set up for this family, moving furniture, building beds, delivering supplies, all during some of those most frightening early weeks of COVID-19 cases increasing in Utah. And other refugees in the neighborhood wanted to help staff set up the apartment or watched from their windows and balconies, sharing words of encouragement. It's a familiar scene as we welcome new arrivals, but this was particularly important right now as we're all facing, the social and physical isolation, that we could still welcome a family to Utah. With regard to refugee arrivals, additional challenge that we'll see is that, refugee arrivals have been paused as of right now into mid-May. This, not only does it mean that we don't get to welcome more families right at this moment, but it also has an impact on our funding for the resettlement program specifically. So we're hoping that as the country phases reopening that we'll see arrivals resume, but the likelihood of us hitting our ceiling of 18,000, which is already incredibly low for the country, is not likely that we would hit that number this year. And then kind of echoing some of the challenges that Josh had mentioned with the unemployment, largely a lot of the clients who have arrived within the last 2 years are not eligible for unemployment insurance. And then some of those would not also be able to get the stimulus because they had not filed taxes in appropriate time, and they're not green card holders. And so we are trying to mitigate those challenges and going case by case to see what benefits they are eligible for. But it's a very complex process, as we all know, and the learning curve and the changes of what's happening on a daily basis is quite steep. And so keeping our staff informed has been critically important in terms of how to help clients access these resources and what pivots and changes, what's available, what's run out. All of these different kind of moving targets is quite challenging. And then most recently, I know there were some questions on the executive order on immigration that was issued today. Our understanding right now is that it does not impact refugees and asylees who are currently in the U.S. or for those who are petitioning for entry into the United States, or for those who are petitioning for family members to join them under an I-730 process. It's largely targeting those outside of the U.S. looking to immigrate to the United States, outside of the refugee and asylum seekers, and that the challenge there is that there's a lack of clarity sometimes when the executive orders are pushed in that way, and the call volume to our immigration team of people who are concerned about family members or their own status just skyrockets, and fielding a lot of inquiries, again, that fear and uncertainty about their own status or those of their family members overseas requires quite a bit of support from our immigration team members to be able to help people understand what impact it may or may not have on them and their families. So it's a trying time on many fronts.
Great, thanks, Natalie. I think we'll shift gears ever so slightly, just acknowledging we have about 20 minutes left on the call. Time goes by fast, everyone. So I think the last question, or one of the last questions I had was, though we are been primarily focused on emergency response and planning for business continuity, there is a long road ahead as we adjust to the new now that COVID-19 has created. While we may not be able to plan more than a few weeks or months out at the moment, I did want to see if we could discuss some of our short-term and long-term strategies for facing a future changed by COVID-19. And Josh, I thought we might be able to start with you if you wanted to take some time, briefly describe some of the strategies that are currently being implemented as we kind of prepare for the future that we face now.
Yeah, for sure. I think one of the things that this has really thrown a spotlight on is just the essential need to connect and include families in our digital world. We're already recognizing, working on, but this has really put it in real time and tested it. And what that has done is really opened up possibilities for us, even if things revert somewhat back to normal over time. Some of the elements of that, sure, working better with hardware that clients are already familiar with, like their smartphones. Computers are important for some things, but how can we communicate with them more effectively that way? For sure, in person for a lot of things, especially with language and other barriers, is better, but those are tools that are there that we could certainly engage better, and are doing that now, and we'll carry that with us forward into whatever the future looks like in terms of how we interact with clients. Another really interesting one is sort of remote work has allowed us to pilot leveraging language expertise and sort of scheduling flexibility across the US IRC network. And what we're doing now is being able to provide trainings, say from Salt Lake City. This is an example that we're doing on financial literacy that clients can call into here in Salt Lake City, but there are also clients in Atlanta, Georgia who need that class for part of their program or are interested and want to learn and happen to speak the language of that particular session, so they can call in and access this Salt Lake City resource from Atlanta, and it's refugee specific and it's for them and it's in the language, but it allows us to add more offerings up to clients and really leverage the strength of the whole IRC network for clients here in Salt Lake City. And then, I guess another piece is sort of helping clients, young people in particular, but in engaging with them in the social media outlets. We use that a lot sort of with broader community, not as much with refugee clients. They use that, and leveraging that to communicate with them as well is a great opportunity, and it allows us to, again, build in more support around online safety, social media safety, sort of information veracity, and all these different pieces. So the remote work is challenging. We're still working on it, but easy to already identify a lot of areas where, this is something that we want to be strategic about implementing, even if things kind of go back to more normal in the future.
I really like the example of being able to have clients call in from Atlanta. I still thought that was one of the coolest things I've heard of recent weeks.
Just to add to that real quick, I was along the lines of the virtual services, is that we've also found that it's a great strategy to mitigate transportation and childcare barriers, which is really very much so the two largest barriers that we have sometimes to our service delivery. So by having an opportunity to test some of these different strategies out in the future, it could become part of our normal programming to be able to offer some of this for particularly those who are limited by transportation and or have kids in the home and need to be able to still access job training or classes or different things like that. So
that's actually a great point, Natalie. I guess I just want to share one other example just from the other day. I was listening in on it was a financial literacy class for our participants in our home-based childcare business program, which is proceeding virtually on the training side. And the women that were participating remotely in that cohort and with some of their children in their home were so engaged and able to do that from their home, take care of the needs they had there, but were also accessing, and it was some of the most eager learners that I'd seen in a cohort for a long time. It was actually really inspiring to me, and a confirmation that you can communicate a lot and make quite a bit work on a virtual platform.
mm-hmm. Very much so.
That's really great. I don't know, Natalie, if you wanted to continue, what are you seeing as kind of short-term and long-term strategies?
Well, and I think one thing that I wanted to add here is I know we've been talking about the digital divide or the digital barriers, but now really considering access to internet as an essential basic need. So we're working on some strategies to ensure that all households have internet shortly at the time of arrival or shortly after, at very low cost through one of our partners, but also that would be a cost that the IRC would cover in their first initial months of resettlement, primarily because in the past clients haven't wanted to cover that because their income is so limited. So even if it is, you know, very low cost, $10, $15, $20 makes a huge difference in a household that, you know, is not bringing in very much on a regular basis. And so in order to mitigate that, that is one thing that that we're planning to do moving forward, because it is a basic need that needs to be addressed early on in someone's arrival. And that I think that is one of the larger changes. And then just also, you know, pandemics and crises like this illuminate the social and economic inequities that exist. And so, and refugees and immigrants experience that inequity just like other vulnerable communities, but it's often exacerbated by language barriers or the inability to access some of the safety net resources like what we've seen with the stimulus that others can. We have a lot of work to do, particularly as it relates to public policy and coordinated service delivery, and from within our communities with our partners, and lots of lessons learned from this. So I look forward to working with our partners and other community members like those on this call, and in what we can do better or how we can do things a little bit differently to make sure that we're able to respond effectively.
I think it's really important to take this moment to find opportunities to change for the better. Pam, I definitely don't want to leave you out from this conversation. If you had a few items you wanted to briefly include, that'd be wonderful.
Yeah, I think the point that Josh made around using the digital technology to actually help folks who may have transportation or childcare barriers actually engage more. It came up today earlier on a call we had with the providers around telehealth and the concern that, for example, Medicaid has loosened up some of the HIPAA requirements and is paying for telehealth now as the same as an office visit. Whether that will go away when in fact it's actually in some cases could really be a positive outcome of this crisis, because people who may struggle to get to a doctor's office but could actually complete an appointment at home, we'd hate to lose that opportunity that it creates. And so I think what's happening for the health program is that some of the ideas that we already had to include remote technologies are just being fast-tracked now. They've always kind of been on the back burner, but now we're saying, oh, we have to do these in order to deliver our programming. So what we've been trying to do is develop educational and training materials for clients that can be delivered remotely, recording videos, turning presentations into videos with narration in the client's language, post them on YouTube, and then share them, the links to clients. We're doing things like pregnancy education, family planning education, health promotion education that includes navigating the US healthcare system, how to refill medications, how to communicate with your doctor, those kinds of things. And actually, again, I think it's really helpful. We'll probably continue to use these even when we return to in-person services, because one of the things that we find is that our clients, they really need to hear the information multiple times to absorb it. This could be because they've had a lot of trauma that impairs their memory, or just adult learning styles vary. And so the idea being that if we provide this through like a YouTube link, the clients can watch it as many times as they want at their leisure, without having to be in the IRC classroom situation. And then we can follow up with them to check comprehension, answer questions, but we don't have to stick to a classroom context in order to deliver this information. The other thing is that we've even started developing some very personalized health education. So something really cool that happened this week is that we had a client who has a number of medications that she needs to take, and she was struggling to remember which ones to take in the morning and which ones to take in the evening. And so we actually recorded with an interpreter on her phone a video of how her pill box should be laid out, and then instructions, you know, take the purple one in the morning, take the green one at night. And again, this is on her phone. And so if she forgets, she can just watch this video, you know, anytime that she needs to. So we're increasing medical compliance, and we're increasing her ability to take care of her health without IRC staff support directly there. And I think, again, that's something we probably should have been doing long ago, but necessity is the mother of invention. Is that the expression? And so I think it's so important to look at the opportunities for growth in ourselves and on our programs and for our clients from this experience, because if you don't, then you're just going to be miserable.
I really appreciate that kind of personal touch, that being able to kind of provide that for a client within this context, where we would normally be reaching out personally, being able to have kind of that backup, if you will, for them. We have about 10 minutes left. I have one last question, and then please, I just want to remind you that if you do have questions about anything that we've been working on or things discussed during the chat today, please post those into the chat. If we aren't able to get to them during the call, we will follow up with responses after the call. So I just wanted to put that reminder there one last time. So just for my final question, though there are a lot of challenges ahead, we have already seen so much support from the community and generous supporters, many of them on this call. From providing emergency response donations to sewing face masks, we are really honored to work in the Salt Lake County community that remains welcoming of refugees even during the most challenging of times. But we could still use your support. So Natalie, what can healthy, willing community members do at this time to support the refugees we serve and our work?
Yeah, that's a great question. Well, first and foremost, I want to thank those who have donated, reached out to check in on our staff or on our clients and to offer their assistance, whether it was donated masks or funders allowing us to pivot some of our resources for COVID response, or allowing us to apply for general operating or unrestricted funds, or in-kind donations. Everything has been incredibly helpful, and we felt well supported in the community so far. We are seeing some delays from funders and asking us to hold off on renewals or delay proposal submissions, while others are opening up new funding streams. So we don't have a real clear picture at this moment of what the path forward is from the funding community. But we do know that we have a very generous community in Utah, and we would ask for support for our emergency response fund. We anticipate another $10,000 in emergency housing assistance that would go out as May approaches. We exceeded our goal for our first emergency response fund appeal, and so we'll be sending out another one. But also, donations or grants or funding opportunities for COVID response are critically important right now. For us, as we continue to offer loans and stipends and other direct service and essential care for the clients that we serve. We have an Amazon wish list that is posted, and you can donate or share that with friends and family who might be interested in getting some resources to refugees directly. That includes things like laundry detergent, diapers, wipes. Gift cards are always incredibly helpful. If you are crafty, sewing face masks is a great thing to do. We've been delivering those to clients as we've been delivering household and hygiene kits and food kits, and interacting with clients for transports for a prenatal appointment, for example. Giving the client a mask as we're engaging with them. We're finding that a lot of people don't have masks readily available. So if you aren't able to sew, you can consider purchasing a mask from a local refugee seamstress that we've been working with for $4, and we'll share the links out for that later. And then just to continue to be ambassadors in your community for our work and for the refugee and immigrant community, and to tell us what you're seeing, especially refugee and immigrant community members yourself. What can we do, or what needs can we help address? What would you like to see more of from the IRC, or how can we shift to be of support to you all? So yeah, with that, I want to make sure that we have some time for questions too, so I'll keep it brief there.
Thanks so much, Natalie. And I'm just looking at one of the quick questions in the chat to respond briefly. So yeah, I will go ahead and we'll move to some of the questions that have come through. I'm just going to go ahead and look at those.
Jesse, can I just say one other thing, kind of a request? So I think mine is more of an advocacy type request than like a donation, but I think if you work for an organization or you are out in the community and you see information being provided around whether it's COVID protection, COVID response, or any of the other things. You know, if you have the capacity to do so, just checking to make sure that that information is being provided in multiple languages and multiple formats for low literacy individuals. I think one of the challenges is, you know, as I mentioned, sort of translation often is an afterthought, but we know that, you know, communities of color, refugee and immigrant communities, they're being the hardest hit by this disease because they work in the sectors where they can't work from home, so they're having to go to work. They have a lot of underlying health conditions and low access to health care. And so I think one of the things we can do as advocates is push for that information to be available in multiple languages and also in different formats besides written formats to make sure it reaches the folks that may not be accessing it so easily.
No, thank you, Pam. We have a couple minutes remaining before we'll have to wrap things up. But one of the questions that did come through that I thought we might be able to pose is we do have a lot of clients, and how are we making sure that clients don't fall through the cracks, especially with things like lack of citizenship or other factors that might be in place for them. I don't know, Pam, if maybe you wanted to start there, but others can jump in as well.
So a couple of things that we do, I mean, within our case managed clients, for sure, we have a weekly case staffing call across multiple teams to talk about vulnerable clients and those that we are concerned about. One of the things that we're in the process of developing right now is kind of a remote client touch point document. So looking at each team, so in the sort of 2 years that we support clients, and especially in this remote context, which is a little bit different, but not entirely, what are the touch points? Month 1, month 2, month 18, month 20, which teams are having access to clients providing different services? And that way we can look and see if there are gaps, places where my suspicion is, you know, especially in the 1 to 2 year period, there are the clients who are very self-sufficient and are really often running and doing things on their own. Then there are the really vulnerable clients that we're very aware of their needs. They have a special needs caseworker. There's a lot of services and wraparound services they're receiving. I think our concern is sort of the folks in the middle, and that's what we're going to be trying to address in the coming weeks is how do we make sure that we are reaching out to them, again, the elderly clients, the you know, clients who are not good self-advocates and wouldn't necessarily pick up the phone. And so that's one of the things we're developing right now is kind of looking across team, what are the touch points and where might there be gaps, and then how do we parse that out amongst the different programs. So also that the burden doesn't fall only on one team, particularly the caseworkers who have a lot on their plates already.
Mm-hmm. And I would just add that was the impetus for the client call list that we had initiated was to make sure that all clients that we've served within the last 2 years, so that 500 households translates into about over 2,000 clients themselves. And we had quite a bit of success. Even some people who were like, oh, I haven't heard from the IRC in a while, but I'm really glad to know that you're a resource, or those who you know didn't know who to contact for a specific need that they might have or hardship. So we are trying our best to make sure that everybody knows that we're available and or to reach out to those who might get missed or fall through the cracks.
Perfect. So I think we have maybe just 2 minutes left. I don't know if there were any final thoughts before I close out the call that we wanted to note.
I was just noticing on the chat some of the questions. Some of them are kind of direct follow-ups that we can do with the chat members who had posed questions or inquiries, and we'll be sure to do that, and then to share the recording for others that would like it. But again, I just personally wanted to thank everyone for taking the time to join our call today, and to listen to the work that the IRC is doing, the challenges and barriers that we're facing, and for your support of the refugee and immigrant community. It means a lot. We feel everyone out there is, is concerned and supporting us at the best that they can, and so it's much appreciated. And our community partners are critical players in this, with the Refugee Education and Training Center and Salt Lake County Office of New Americans and Department of Health. We're all working closely together to make sure that we can be as responsive, and look forward to the lessons learned from this as we resume some semblance of normalcy, knowing that our worlds will probably never be the same. So thank you.
Natalie, in our last few seconds, I did see a couple questions come in right at the end about staff self-care and psychosocial support for staff. I think it would be great if you had a chance to respond to those.
Sure, I would be happy to. It's definitely something that we are emphasizing right now with our staff members. We have a few different resources that are available. Mental health support, we call it Duty of Care, a whole website that is offering a variety of services to our staff members to make sure that they have resources, from meditation apps to an additional 15 days of personal or sick time to deal with childcare, or parents who need assistance, or if you fall ill or you need your own mental health care. That's definitely a resource that we're offering, and continuously talking about it. It's really something important, and we take seriously in encouraging our staff members to take some time away from their computers, especially with people working at home. Feels like you might not ever be able to get away from work, and so we are being very conscious of that. And thanks for that reminder to take care of ourselves, as you all should be too. So thank you.
Perfect. Thanks so much, Natalie. And thank you all for joining the call today. I really would like to thank Natalie, Josh, and Pam for taking time to discuss more about our efforts in response to COVID-19 and really describe the challenges that our organization faces, but also the refugee families that we're serving face on a day-to-day basis. I know we weren't able to answer all of the questions posed on the call today, and I'll work with Ali and my team to compile the remaining questions and email out responses to the group or to individuals who have joined today. Additionally, we'll include a link to the recording of this call so you can share it with your networks and come back to it if you have reminders or have more questions about the call. Finally, again, just a sincere thank you to each of you for taking time out of your week to join our call. With your support and partnership, we're able to continue our work serving refugees in our community. So thank you, stay well, and be safe.
Thank you.
Thank you.
Thank
Bye.
you. Bye-bye.